which is the main reason for the coronary artery blockade. Okay, but still after clearing the clot, because sometimes patient already has a conditions or symptoms of Assalamu alaikum and welcome to our YouTube channel. My name is Dr. Syed, and in our today's video is about the condition called heart attack or myocardial infarction. So please stay connected with us, and if you are new to this channel, please like and subscribe our channel and share this video to your family and friends. Thank you so much. Okay, let's discuss about the heart attack. So heart attack is a condition where the blood supply to the heart, heart has its own blood supply, and mainly the coronary arteries. The right coronary artery supply right side of the heart, and the left coronary artery supply the left side of the heart. But so in heart attack, what happened if something happened with the heart, if in any interruption in the blood supply of the coronary arteries, that causes the heart attack. So in other words, we can say the lack of blood supply to the heart seriously damage the heart muscles and this can be a life-threatening. Okay, and heart attack is an emergency. Okay, so if you see someone having symptoms of heart attack or in your family, and like outside somewhere, so you can so first step is to call for help and call for emergency services like ambulance, or dial the number which is emergency number in your country and ask for help. Okay, so this is the first step. As I said, due to the interruption of the blood supply to the heart, this condition arises and it can seriously damage the heart muscles as well. So how do you differentiate between the heart attack and the symptoms of reflux, GERD, gastroesophageal reflux disease? Because sometimes the symptoms of heart attack and the gastroesophageal reflux disease symptoms are similar, you should know that how to differentiate between these two, because in heart attack our patient will experience the symptoms of heart attack, which can include the chest pain and feeling of pressure or heaviness or tightness or squeezing across your chest, because patients usually describe the pain of heart attack is like an elephant is sitting on your chest. Is that type of heaviness. It's not a minor heaviness like elephant can sit on your chest. It's just a severe, like a very very pressurized heaviness or tightness you feel across your chest. Okay, but in gastroesophageal reflux disease you will also feel the symptoms of like heaviness, but not that type of heaviness that you are experiencing in the heart attack. Okay, and also if you are having a heart attack, it is very difficult for you to walk, because symptoms of heart attack, when you walk you will feel a severe type of pain. But on the other hand, if you are having a symptoms of GERD or gastroesophageal reflux disease, and then you are able to walk. Okay, even though you are having some discomfort in your chest, but you are still able to walk. You will not feel pain in your chest when you walk. Okay, but with the heart attack you will feel severe pain, or your pain become worse if you try to walk during the heart attack. Okay, so that is the main differentiating point. Also, the other symptoms are feeling of lightheaded and dizziness in heart attack, and you will experience a sweating and shortness of breath as well in the heart attack. Okay, and patient can sometimes feel sick, or patient can feel the anxiety, or they also describe the symptoms of coughing and wheezing during the same time. All right. So most common symptom is a chest pain, and it depends person to person. Like in some cases, shortness of breath is present, and feeling of sick or jaw pain, neck pain, jaw pain, pain into your left hand is also present. Okay. So how to treat the heart attack? So the major treatment or the main treatment of heart attack is, while you're waiting for the help or waiting for the ambulance, you should take at least 300 milligram of aspirin. Aspirin, if you're not allergic to aspirin, the patient can take the aspirin. The main aspirin try to dissolve the blood clot, because in heart attack what happens, your coronary arteries are blocked due to the blockage of coronary arteries, and that blockage is caused by the erythroma or plaque, which is already developed in your coronary arteries. Okay, so aspirin can help to dissolving the clot a lot. Also, when you get to the hospital, the first treatment you will be given is the antithrombolytic agent. Antithrombolytic agents help to clearing the clot, which is the main reason for the coronary artery blockade. Okay, but still after clearing the clot, because sometimes patient already has a conditions or symptoms of angina. Angina is a condition that is not a heart attack, but that is the symptoms. Angina also cause the pain in your chest when you walk or when you sitting. It depends what type of angina you are having. Is a stable angina, which is you will feel pain when you're walking, but unstable angina, you also feel pain when you walk and also on your rest as well. So those angina conditions sometimes preceding to the heart attack. Okay, so that's why you have to keep an eye on your symptoms, whether it is just a acute symptom or you already on the treatment of the angina and the angina is leading the heart attack. All right. So major or the ischemic heart disease, some patients already diagnosed with the ischemic heart disease condition, where your heart or your coronary arteries are already blocked by the plaque or by the cholesterol, and you're already taking the treatment. But what happens is the clot, due to the blockage, the erythroma sometimes break, and it can cause the blockage. They can completely block the blood supply to the heart. So that is the reason for the heart attack or the myocardial infarction. Okay, so patient can also develop some complication of the heart attack. These include arrhythmias and shock and some heart rupture as well. Sometimes the heart muscle can become a rupture and the wall of the heart split. Okay, and these are very common cause of the death as well. These complications quickly leading the after the heart attack and the leading cause of the death. Okay, because some people die suddenly due to the heart attack, and due to these type of complications like heart rupture, cardiogenic shock, and arrhythmia. It depends on the complications are depend on your age as well. If the complications are serious or you are very old, so the most likely chances are your heart is damaged by the heart attack. Okay, and so what treatment options are available? As we discussed about the you can start. So first of all, they will diagnose what type of heart attack is. There are like one condition is called ST elevated MI, ST, and no other is non-ST elevated MI. So the treatment depend upon the type of MI. Okay, when you go to the hospital, they will perform the ECG on your bed, or they will see what type of myocardial infarction, which area of the heart is blocked. Then they will also order the bloods. Okay, so you can tell the type of MI, because the troponin is an enzyme which can present in your blood if your heart muscles are damaged. Okay, so heart attack is or myocardial infarctions means due to blockage of blood supply, hearts is starting to damage, and that the troponin, which is basically an enzyme released or secreted by the damaged heart muscles, yes, you can diagnose through the by ordering the bloods and look for the ECG, and then order the echocardiography if you think there are some valvular heart diseases also present, and these diseases are the reason for the chest pain or myocardial infarction. Okay, so also depend upon your symptoms. Sometimes they offer you a treatment of percutaneous coronary intervention. We call it depends. It's called cardiac angiogram or cardiac angioplasty. They perform the cardiac angiogram and they look for the blockade, like if you have one vessel block, two vessel, three, four, and they start planning your treatment. Okay, for example, if they think they can, if your condition is basically in one, two, or three coronary artery, they start thinking about it, and they will think about it, and they can perform the coronary angioplasty, and if the balloon coronary angioplasty, and they will also use the stent as well, because the stent will open your coronary arteries, and they will keep open your coronary arteries after your operation, and your symptoms will become resolved and subside after the stent is opening that blockade. Okay, in some conditions they also perform the cabbage is coronary artery bypass grafting, or they take the one artery from your own body, like they usually take internal memory artery, and they perform the coronary artery bypass grafting. Depends if you have a severe coronary artery disease. All right, so treatment is basically depend upon your symptoms and condition, your type of heart attack or type of MI. Okay, so of course they give you a medicine which break down the blood clots. Those medicines are called thrombolytic agent or fibrinolytic substance. Fibrinolytic thrombolytic agent. They use those agent to dissolve the clot. All right, but they will perform coronary angiography, and they depend upon if the thrombolytic doesn't work, then they will perform the coronary angioplasty stenting, or they can perform the coronary artery bypass graft as well. Thank you so much for watching this video. If you like this video, please like and subscribe our channel and share this video to your family and friends. Thank you.